Okay, let's talk about some laparoscopic instruments. I have laid out here some laparoscopic instruments and supplies that you will use for laparoscopic procedures, and we're going to go through each one of them so you know what they are. So the first one is your camera cord, okay? With your camera cord, your scope, 10 degree, 0 degree, 5 millimeter, whatever, will go here, and this will stay on the field. And you'll always want to make sure when your scope is attached and the fiber optic cable is attached and that light beam is coming through, that it's not on the drape or anywhere, because it gets hot and can burn a hole, so you'll be careful about that. But also, this is the end that you're going to pass off to your circulator. So in lab, we'll practice throwing off cords. So this is the end you'll throw off to the circulator, and they'll hook it up to the laparoscopic tower. So the first thing is your camera cord. Along with your camera cord, you're going to have a fiber optic cable or a fiber optic light cord. Okay, again, this end is going to go off to your circulator. You're going to pass off that cord, and this one you're going to hook to your scope, and that's going to provide your light source. So that's your fiber optic light cord. Then we're going to have irrigation tubing. So again, another cord we will pass off. This passes off to the circulator. This stays on our field, and you can irrigate by pushing these buttons, and this is a filter that comes with it. So another cord you may pass off is the irrigation tubing. Then you have insufflation tubing. Insufflation tubing, they look different. They can look square like this, they can be round, but they still have this filter. This is what we hook up to create our pneumoperitoneum by putting the gas into the patient. So that is your insufflation tubing, okay? Next, we have what we call Gary or igloo. Some people call it Gary, some people call it igloo. You can take this out. I'll actually see if I can open this one-handed so I can show you the inside. All right, when you are counting this, okay, there's multiple pieces in here, and you have to count them all. So you have your igloo, kind of looks like an igloo. You turn it on, and your scope will go in here to keep it warm, and I'm not gonna, your scope goes in here. There we go. Your scope will go in there so it stays, will warm up, so it'll be warm to the body temperature. It says insert for 5 seconds. When you count this, you count the igloo, you count the wiping cloth, and you count what we call a tampon. Okay, so all of these would be counted 1, 2, 3. Sometimes it comes with 2 tampons, so you count it 1, 2, 3, 4. But either way, you count these together. So that is your igloo, and that is for your scopes. Then we have a Verus needle. The Verus needle, again, like I said, is how we can use this to create a pneumoperitoneum. They'll put this in the umbilicus. This is your Verus cord. It's just like a long needle. Then we have various types of trocars. Now, remember when I was explaining during our lecture that trocars come in different sizes? This is your balloon or Hassan trocar. It has this gel here. Some people have called it a gel port because it's got that gel. Your laparoscopic instrument is going to go through here, and then that's how they'll, typically they put that in the umbilicus. And then other trocars, you'll have like a 5. I believe this is an 11. Nope, it's a 12. So they come in different sizes. So the preference card's going to tell you, once we put this into the body, we'll take this inner cannula out, place it on our back table, because then that leaves the inner cannula and we can put instrumentation through there. So those are various sizes. On your instrument quiz, if I have this out, you'll say 5mm trocar. If I have this one out, you'll say 12mm, 11, whatever it may be, or Hassan. The next thing that we have is what we call Fred. Fred is also an anti-fog solution. When we count this, it's going to come with your bottle of solution, and it's going to come with this little gel foam pad. You count this as 1, 2, 3, because this cap can get lost in the body. So it would be 1, 2, 3. So that is Fred. So then we're going to talk a little bit about a few laparoscopic instruments. Now keep in mind, these are by far not all the instruments, but it's a good variety of what you possibly have. Your instrument sets for laparoscopic will come for various things. So one of the things that we have is a laparoscopic scissor and tip. So if you'll notice that the tip of this has like a screw joint on it, because we can screw this laparoscopic scissor tip right on it, which means we can change out the tip. So that's a laparoscopic scissor with tip, okay? And then the next thing that we have is a Prestige, which is a grasper. Okay, if you look at it, you can see the teeth on it, a Prestige. Then we have a single tooth tenaculum. If you see, it's got teeth, they're pretty sharp. And after the single tooth tenaculum, we have a Maryland grasper. Very common. You'll see the Maryland a lot. You'll see the Maryland and the Prestige a lot. You're going to see other types of graspers. And then we have different scopes. So these are both 0 degree scopes, because remember, the 0 degree has a flat surface. So this one is a 10mm and this one's a 5. So on your instrument quiz, you're going to say 10mm, 0 degree, 5mm, 0 degree scope. Okay, this is the scope that will connect into right here into your camera cord. Okay, all right. Now we have some various instruments that we will use in laparoscopic surgery and staplers. Okay, number 15 is your ligature. Of course, this gets passed off to the circulator so she can hook it up, and then this goes in, and they can go in and they can coagulate and clamp off tissue with that. So that is a ligature. The next thing we have is a clip applier. If you remember, we had clip appliers in one of our instrument tests. This is the same thing. It's just laparoscopic, of course, because it's long and can go into the body through the trocars. Then we have a couple different staplers here, okay? So the first stapler that you see here is the EEA stapler, okay? Then you will have a TIA stapler. I don't have the linear stapler out, but I'll show you how to use it. This is another Liga clip, and this is an EEA. So this is the EEA. This comes off, goes into the bowel tract. This goes into the rectum. They mesh together, and the big important thing here is when you take this off, you have to look for that complete donut ring when you take it off. This is an EndoCatch bag. They come in different sizes. You'll put this through the trocar or through the abdomen and take out whatever you're taking out of the body. And of course, this is what a laparoscopic stringer may look like. You'll have a small stringer in your laparoscopic set with some basic instruments and then an S retractor. And that's your list. You can study for the next couple weeks.